Yes, welcome everyone. And as usual, my name is Dr. Jethro Nwasima, and today we shall look at health part of this, and we shall be learning about some of the conditions that affect our lives, as we shall see in front. So today we are going to look at malaria. Malaria is one of the leading killer diseases across the globe, but especially when it reaches in Africa, where we have tropics, it becomes too much. It becomes too dangerous. So today we are going to look at that, malaria, where we shall be able to see what could be the definition of malaria. How can one know that I have malaria? Call them signs and symptoms. Then, and of course, we shall see how can we manage malaria. Then again, we shall see what can be the prevention, the preventive measures of malaria. And lastly, we shall also look at some of the complications of malaria. Yeah, so before I continue, I will call upon everyone to kindly subscribe and you should be able to get the notifications regarding your health. This time we shall look at health. Next time when I come, we can look at finances maybe. Then another time we can also look at entertainment. Yeah. So in case you want to get notifications that I have posted my videos, you can click in subscription sign there, and you will be able to get notifications and regarding my videos which I'll be posting here on my channel. You are welcome once again. Let's go strictly to the cause of the day. Yes, malaria is a tropical disease, call it an infection, that is caused by a protozoa, which is spread by an infected female anopheles mosquito, then caused by falciparum, Plasmodium falciparum, or Plasmodium as a whole. Because Plasmodium has got many species, you can look at Plasmodium falciparum, you can look at Plasmodium vivax, Plasmodium malariae, Plasmodium, like 5 or more. But the commonest is Plasmodium falciparum. Yeah, that is malaria, and that is how it is caused and spread in the same way. So now we go to how can someone know that I have malaria? Yes, what could be the signs or symptoms or the key points someone can see on a patient and on his or her fellow, on a child, on a female or a male? Then he or she tells that maybe we have malaria disease infecting this person. So one is joint pains. Yeah, joint pains is one of the common diseases, which are rather common symptoms, which usually affects these people with malaria. And of course, it comes in as a way of weakness, as this parasite enters into the body, causes that issue of severe joint pain. It is not common in many diseases, but when you see it in a child or a patient, an adult who has not had such a complaints before, they will be able to know that this is really malaria. Then another thing is can be nausea and vomiting. Yeah, this patient usually lacks appetite. Yeah, and he usually gets that urge to vomit, or at the same time he or she vomits. So it is also the commonest sign, which is usually presenting with these patients having malaria. Then another sign can be, there is in severe cases when we have anemia. Anemia means that this patient's blood hemoglobin levels have reduced, and you will see that this patient is having a very white palms or soles of the feet. You can call it pallor in science, call it pallor, but for understanding of everyone, there is that the palms color changes from pink to being almost white. Then there is a reduced capillary refill in that patient. Still, when you try to do some capillary refill, how we do capillary refill, I will be showing you how you do capillary refill, and you know that maybe the return of this person's blood is not as quick as it should be. Yeah, so that is another sign, which is anemia. Then there is also fatigue, or you can call it malaise, you can call it general body weakness, whatever. But this person looks to be very weak, and is intolerant to activities. The daily activities, cannot do exercises. It is also so common when you get this when you get this disease. And then another thing in a severe case is, again, you find this child or this patient, adult, whatever, gets what we call organomegaly. Some of the organs in the body tend to enlarge as a result of hypertoxicity. And this person, if it is a liver, it is enlarging because of the response toward this infection. If it is spleen, it can also enlarge. If it is pancreas, it can also enlarge. So there are some of the signs and symptoms. Then another commonest one is what we call hypothermia. You can call it a fever. A fever is a common sign of a common symptom which we usually get in patients with malaria infection. Then another one is also what we call headache, severe headache. It can be migraine, it can be tensional, it can be positional, it can be any form of headache, but which is severe. So these patients usually present with these signs and symptoms as we have seen above. Yes, then how do we manage these patients? Usually, we first manage signs and symptoms. Take, for instance, you are at home and someone develops a fever. So what we do, you first manage signs and symptoms at home as you plan to go to the hospital or a health care setting where you'll be able to get further management. For instance, if the child develops a fever, you can expose a patient. You can give a warm drink for this patient. You can give a bed bath with, of course, warm water. This person, so that at least the fever shouldn't go past the normal, or shouldn't go very high than the normal. Then if it is nausea and vomiting or diarrhea, you can continue rehydrating as you go to the hospital. Give some sips of drinking water or anything which can help to rehydrate this patient, because as this patient is vomiting and dilating, is losing some of the electrolytes and mineral salts from the body, and of course the hydrants, the water. So if this patient loses all that, is likely to go into hypovolemic shock. So keep rehydrating with some sips of drinks, especially water. then you plan to go to the hospital for further management. Yes, in hospital, when you reach, of course, they will take history, they do examinations, they can request for investigations as blood smear or MRDT to confirm, of course, to confirm the infection. Then if confirmed positive, of course, you'll be initiated on the anti-malarial treatment according to the severity of how your patient will be, or how your person will be presenting to these healthcare workers. Then what are the complications? Can we talk about complications? Yes, and of course, over 75% of patients with malaria infection, they usually present with complications. And this one usually comes as a result of delayed treatment. They usually delay start treatment. So by the time they go to hospitals, they already developed complications, which may be hard to manage. But though they can be managed accordingly, if the healthcare setting is very well organized and has the equipment to use, so it becomes hard, though it can be managed. So these are some of the complications which usually come in as a result of severe malaria. One is that these patients may develop what we call cerebral malaria. It can present as meningitis or as acute CNS infection, but they usually present with malaria, cerebral malaria. Malaria grows and goes towards the brain. It starts bringing signs like convulsions, like coma, like distress. Of course, you know the brain is the control of everything on this human body. So that is one of the complications. Another one can be anemia, like we have seen in some of the symptoms, that anemia can also be a complication, where, because we have seen that these parasites usually feed on red blood cells, and the red blood cells are responsible for transporting oxygen and making more of the blood in the human body. So if they are fed on, it means that its production will be affected, of course, and the number will reduce, which will bring about low hemoglobin levels, hence anemia. Another thing can be organ failure. We have seen that it can bring about organomegaly. So as a result, organomegaly may also in turn result into organ failure. You may find the liver is not functioning, the spleen is not functioning well, because it is extremely affected and it cannot do its functions as usual. Another complication is, of course, acute kidney injury, due to the fact that these parasites are often transported in blood, and what is responsible for filtering blood is the kidneys, the nephron. So you'll find that they are also affected, and the filter of the kidney is maybe affected and it cannot filter very well blood. So you'll start seeing blood in urine. You'll start seeing the patient is not passing urine very well, no matter how much he or she drinks. So you find that almost everything is almost becoming a mess. That is acute kidney injury or renal failure at the same time. Then let's look at preventive measures. Before we look at the preventive measures, and of course, complications are so many. They can be more than 10 or more than 20. There are so many as a result of severe malaria, of course. So we have to make sure that at least if a patient is having malaria, do what is necessary for him or her. So how can we prevent malaria? Very many methods or tactics can be used to prevent malaria, as we are going to see. One is that we have seen that these malaria cases are so, or infection cases are so common in tropics, where we have a lot of bushes. So what we can do as the usual people, we can clear the bushes around our homesteads, so that we destroy the breeding places for these mosquitoes. Or we can also drain the stagnant waters, because they also act as the breeding spaces for these mosquitoes. Or if not drained, you can spray on top of these waters with something like oil, so that still their life cycle is affected. Then another thing is that we can also do what we call sleeping under mosquito nets, which are of course treated with insecticides, which kill these mosquitoes before they bite us. Then another thing, we can also look at closing the windows early in the evening, use of wire meshes in our windows or ventilators very well, so that these mosquitoes do not enter into our living rooms. Then we can also do vaccination against or immunization against malaria, where we have, of course, these children usually being immunized against malaria with around, I think, 4 doses of the malaria vaccine. Then another thing, we can also do prophylactic treatment. These people who are going to areas of endemic or pregnant mothers, they can also prophylactic treatment. We give them Fancida OSP, which help to prevent this disease before it attacks the human body. Yeah, there are also so many, but I think we can stop here for today. In case you have any question regarding malaria disease or malaria infection, you can put it in the comment section, and I will be available and ready to make for you a video replying to you, or we can give a document where I can reply to you as soon as immediately. Thank you very much for watching us. Keep the spirit burning, and of course, keep up here. We shall be giving you more and more information regarding health, regarding finances, regarding entertainment. Yeah, thank you very much for watching.